I'm sorry. Esther.
Yeah, sorry, hold on. Okay, yate everybody. I don't know if you missed me, but I missed you. I would just like to start off in a good way. My name is Esther Lucero, and I'm Dene and Latina. And depending on where you are residing right now, I think it's really important that you take a look at the original peoples of that land. I know we have people probably working from all over the place. For me here at the Seattle Indian Health Board, I'm on the land of the Duwamish and the people of the Salish Seas. And I think more importantly than acknowledging the land, we need to behave like guests on this land. I am a guest on this land, and I express gratitude every single day to the tribal communities who are from this land for allowing me to be here and to do this work. And I move through the world with that in mind. And so a land acknowledgement is much more than a word, it's the way you behave. And that's what I'd like to say today to start us off in a good way.
Thank you. Thank you for providing that land acknowledgement and that acknowledgement of how we interact with each other and how we um, share space together and acknowledge that. Thank you. Um, Everyone, welcome and thank you for joining us again. I would like to introduce our panelists that are going to be here sharing knowledge and information about the COVID-19 vaccines. We have Ahmed Ali, who is an innovator, an entrepreneur, a systems thinker, and a change maker with a passion and experience in the areas of health equity, social impact, and community resilience. Dr. Ali is an active member with the Somali community with an emphasis on immigrant and refugee health, and also serves as one of the founders and the current executive director of the Somali Health Board, a grassroots organization with ambitious goals of reducing and eliminating health disparities that disproportionately affect the Somali population throughout King County and Washington. Ahmed was born in Somalia and currently lives in Kent with his wife and children. He has served and sits on various advocacy, policy, and system change tables, including Fred Hutch Community Advocacy Board, HealthierHere, and the City of Seattle's Sweetened Beverage Tax Advisory Board, and believes healthcare is a universal right for all. Thank you for joining us, Ahmed. We also have Marguerite Ro, um, who is Dr. PH, is the Chief of Assessment, Policy Development, and Evaluation Unit and the Director of the Chronic Disease and Injury Prevention Section of Public Health of Seattle and King County. She is also the King County representative to the Communities of Opportunity Governing Group, and she is the she has been at the health department for 10 years now and previously worked on national health initiatives to address health disparities and inequities with underserved and marginalized communities in the United States. Thank you for joining us, Marguerite. And we have Esther Lucero, who is Dene and Latina descent. She is currently the president and chief executive officer for the Seattle Indian Health Board. Ms. Lucero is dedicated in her work to promoting policy change for urban American Indians, Alaska Natives, using multimedia approach. She is a trained digital storytelling facilitator and the founder of NAHC Media Center in Oakland, California, where the use of culturally specific digital storytelling has been instrumental in changing the public view of urban Indians. She is committed to increasing the visibility of American Indians living in urban settings, to transforming the way research is conducted in urban Indian health, and to making media and technology accessible to Native communities. Her most recent film production, Killing the Seventh Generation Reproductive Abuses Against Indigenous Indigenous women, is a documentary that calls attention to the forced sterilization of Indigenous women. The film initially screened at the 2010 Queer Women of Color Film Festival in San Francisco. She currently has 2 publications from Tradition to Evidence, Decolonization of the Evidence-Based Practice System, which is in the Journal of Psychoactive Drugs, Roots, and Native American Evidence-Based Practices. Thank you for joining us, Esther. I would like to thank all of our panelists for joining us today. Sorry. And so we can get a sense of who's in the room with us that's joining us from the community. Tavish is going to launch a poll for our community members. So if you can take a moment to just answer that quick poll question. And while you're doing that, I'd like to thank all of you for taking the time to join us today and thank all of our panelists for coming here to share information on COVID-19 vaccines. And while you're all still answering that, for the community members who have joined, we'll be starting with a question and answer session of predetermined questions for our panelists. And then we will move into an open Q&A session after, where our community members can ask questions of our panelists. All right, and being displayed right now, it looks like we have 32% are from community, 32% are staff members from community-based organizations, and 37% are staff members from clinical organizations. Thank you for joining us. It looks like we have a really nice, even balance of all of our community members and staff members from CBOs and clinical organizations. That's wonderful. All right, and as we're going through our predetermined questions, please feel free to write your questions in the chat box at any time. Mayani will be collecting those so that we can have them available when we move into the open Q&A session. All right, so for our first question, it's for Ahmed. So we have 3 vaccines in use right now. We have the Pfizer, the Moderna, and the Johnson & Johnson. And we're hoping that you could share what some of the differences are between those different vaccines.
Thank you, Gabriel, and good afternoon, everyone. I really appreciate this opportunity to share space with Marguerite and Esther. And please feel free to chime in any as I discuss what the differences are with the different types of vaccines that are currently available in the United States. As most people, I want to start off by saying that I really enjoy having conversations about COVID. I could never have enough of it. So thanks to HealthierHere for organizing this and for folks who are able to join. So currently there are 3 vaccines that are approved for emergency use during the pandemic, and that includes Moderna, Pfizer, BioNTech, and Johnson & Johnson. So, you know, there are a lot of questions that come about which one should I get and what's the difference between one versus the other. And I'm just going to go over that just quickly over like high level understanding of what the difference are. The first 2 that were approved initially, Moderna and Pfizer, are what's called messenger RNA, mRNA type of vaccine, which is a new technology that uses spike proteins. And those are 2 doses. So Moderna and Pfizer are 2 doses that are, you have to get first dose and then wait a certain time. With Pfizer, you have to wait 3 weeks, and the Moderna, you have to wait 4 weeks. That's the difference between those 2. The third vaccine, Johnson & Johnson, which was recently approved, is a one-shot vaccine, and that you only get it one time. So that's all you get, just one time, and it uses different technology with regards to SARS-2 COVID vaccine. And the other difference that oftentimes that folks need to know is that when it comes to the vaccine itself, the efficacy, or you know, you hear a lot of people who have misinformation or misunderstanding in terms of, one is better than the other. Technically, one vaccine is not better than the other. Whichever vaccine someone has access to should be able to get that. But there's a lot of numbers that are thrown out there, efficacy percentage. So with the two messenger RNA vaccines, those are Moderna and Pfizer, around 95% efficacy after the two doses that you get in comparison to the Johnson & Johnson. And there, you get that a lot of times information about 67% efficacy, but that depends on what that actually means, whether it's moderate to severe COVID. And a lot of studies that they've done with Johnson & Johnson actually showing it's about 85% overall protected from COVID in general. Those are some of the differences when it comes to the vaccines itself in general, the three type of vaccines that are currently available in the United States. There's also a different aspect in terms of that doesn't impact the general population as far as the storage and the transportation aspect of it. Why are you able to find the vaccine in certain places and you're only able to find specific vaccines in a certain locations? In the case of Pfizer, that requires a very cold temperatures and requires a very specific temperature storage, and that's why you probably find in hospitals and some facilities that have specific requirements for the storage before the vaccine is actually utilized. It's not so much so with Moderna. It still requires some freezing and storing in cold temperatures when it's being utilized. And that is the difference when it comes to storage of the vaccine, which I think the general population doesn't mean much other than, you're not going to find Pfizer in specific pharmacies because they don't have that type of storage to actually keep those. So maybe hospitals, some clinics, and some pharmacies, maybe they have their own specifically designed locations just to store those vaccines. But with Johnson & Johnson, you can actually store that in a normal refrigerator, any other, within the cold storage and refrigerator. So, and that's where the accessibility and transportation is a lot easier, in my opinion, when it comes to Moderna and Johnson & Johnson. Now, there are a lot of questions that come along with, what are some of the side effects that people feel about the vaccines? And in most common side effect, and this is very common with all the vaccines, is that there hasn't been anything what's considered anaphylactic reaction that is, or certain type of major concerns with the vaccine itself, other than what I will say common side effects, such as injection site reaction, fatigue for some people, headache, muscle pains, and joint pain for some folks. To date, we don't have anything that clearly, when millions, hundreds, almost 150, and Marguerite can probably correct me in terms of how many people have received across the country, but over 120 million Americans to a certain extent. And we've seen a very, very small number of people who have actually experienced anaphylactic reaction to the vaccine. And in most cases, the people who have actually experienced that are people who have actually had prior experience to general vaccines in particular. And that's something that we often tell patients, like if you've had the reaction to the vaccine, that's the intake form itself requires that we have to know, we have to be monitored closely. And that's why if you have the opportunity to get the vaccine, most likely you have to wait for 15 minutes. That's observation time to make sure nothing is going to go through for you to feel as far as the reaction. But if you have a history of anaphylaxis reaction or a history of, let's say, hives developing with the vaccines, sometimes you have to wait about half an hour. And I will oftentimes advise those kind of patients to actually do that in a very controlled environment, if that's the case. So any questions following that, I'm happy to answer.
Thank you, Ahmed. That was a lot of great information to take in. Thank you for all of that. And our next question is for Marguerite. And for us to have all these 3 vaccines, they had to have gone through trials. And we've heard some questions from community members about how did they make it through so quickly. So we're hoping that Marguerite might be able to answer a little bit about how we had these vaccines available to us so quickly.
So, hi everybody. Happy National Public Health Week. And I will say that we have all been a part of public health, especially over the past year. So in terms of the clinical trials and why they were able to get through so quickly, I think there are a couple of really basic reasons. One is that governments across the world actually invested in the development of these vaccines very quickly. The US in particular put money up front to move vaccine testing really rapidly. And one of the things that allowed us to assure that there was sufficient testing was in fact because transmission of coronavirus was so high. So versus waiting for a rare event to happen, because we had a high rate of transmission, then those folks who got those early tests around the vaccines, you could quickly then get results. So we've probably never seen this level of coordination amongst research entities globally as well as domestically as we have in this experience. The other thing that I'll just say is to note that we have decades of vaccine development that we're building off of. So if you think about every year, there's a new flu vaccine that's very similar to the Johnson & Johnson. The mRNA work had been going on for many years. And so we're building off of years and years of science in order to get these vaccines through.
Thank you. And what also came out with the vaccine were some of the efficacy numbers, which Ahmed also touched on earlier. So this question is for Marguerite and Ahmed, is what do those efficacy numbers actually mean?
Well, I'll give it a shot, and Ahmed can, and maybe if he wants to interpret it in a different way. But for an everyday person, the easiest way to think about it is if you take a vaccinated person compared to an unvaccinated person, right? So the person who's vaccinated will have a 95% less likely, for instance, to contract COVID than an unvaccinated person. So again, if you're vaccinated, you're 95% less likely to catch COVID than an unvaccinated person when you're exposed.
Yeah, I think that just clearly explains what efficacy what I mean. The only thing I can add is a lot of times, for instance, with the recent studies that Pfizer is doing with young children, right? As an example, what they did is, in order to determine whether this vaccine is going to be suitable for young children, what they did was they actually tested a certain amount of the vaccine. I think about 1,319 children, they give them the vaccine. And out of those, and 39 of those kids, they didn't vaccinate. So the studies we've seen just coming out a week ago shows that Pfizer's vaccine is actually 100% effective when it comes to young children. So basically 100% of those kids who are actually vaccinated protects them. What Marguerite is implying in this is that if with the Pfizer 95% effective against the coronavirus for adults, that means 5%, there's a 5% chance you might not actually be protected, but you are almost 95% protected from the coronavirus should you be exposed to. And I think that's where another point that comes in towards the community is that, yes, you're vaccinated, you're fully vaccinated by the 2 doses, you still have to mask up, you still have to social distance, you still have to observe those public health information that folks are sharing. And the other question that you had asked earlier, and that Margaret answered, I think Margaret asked it, that regards to in regards to why it was developed so quickly. I think there's also another piece that, for vaccines to be developed, oftentimes you need a sample. You need X number of people to actually see if this vaccine is going to work. We clearly know that there was no shortage of sample for COVID-19. So, while, there are multiple pharmaceutical companies who are developing, I think it would have been a lot harder for us to come up with a solution a lot quicker if, let's say, they have a small sample of people to test whether these vaccines are going to work, or even to check the efficacy and to a certain extent. That's why I think it took a lot quicker to develop those vaccines, on top of what Marguerite had mentioned with the technology, advanced technology, and the entire world, all these pharmaceutical companies around the world coming together and finding a solution for this pandemic.
Thank you, Marguerite and Ahmed. And with there being no shortage of samples and of for the trial for the vaccine, and the rollout of the vaccine needing to be kind of quick, how this question's for Marguerite. How did equity play a role in the vaccine distribution rollout for King County specifically?
So number one, we know that there continues to be a shortage of vaccine, right? So that the demand exceeds the current amount of vaccine that we're getting. But public health is importantly, we set some equity principles for vaccine distribution, and those are to remove barriers that deter access, create an inclusive process, and be intentionally anti-racist and accountable to Black, Indigenous, and people of color communities. And what that really means is that we're working with distributors of the vaccine to making sure that we really focus our efforts on those communities that have been most impacted by COVID. And by doing that, it is working with providers, for instance, to give early access or preferred access, working with community-based organizations and trying to get funding that would support pop-up events or community vaccine events, to work on having mobile vaccine delivery and working with our partners to do that, so that we're making sure that we reach the most vulnerable populations. And then really working with community navigators and our community partners, such as HealthierHere and the HealthierHere community partners, on understanding and being really informed about the vaccine. So really happy to participate in forums like this and to partner with folks like at the Seattle Indian Health Board and the Somali Health Board.
Thank you. And our next question is for Esther, the CEO of Seattle Indian Health Board. How are hard to reach populations and communities who have been disproportionately impacted by COVID-19 being prioritized?
Yeah, thank you, April. So I always come from a Native perspective, because we often say that if you can solve the challenges that Native people face, you can solve challenges for many communities of color. So first I want to let you know that there were many Native people who were actually included in the clinical trials. So I want to be very clear about that. And it's been deemed safe for our communities, which is also good. So that's one way we were prioritized. That doesn't often happen. So, and then I would just say, like in regards to distribution, I'm going to speak again from an Indian Health Service perspective. So the tribes in working with the state and the federal government were given a choice as to where we could receive vaccines, not to identify ourselves as a tribe. We were lucky that the tribes have included us as urban programs to make sure that we maintain this continuum of care. That said, we had a choice to receive the vaccines through the Indian Health Service or to receive them through the state system. And so some tribes chose IHS and some tribes chose working with the state. And a lot of that depended upon the administrative burden, quite frankly, and the data collection, and how quickly and consistently we could get replenished. Now, because tribes are sovereign nations, they had the ability to decide how those vaccines were distributed, right? So didn't necessarily have to follow the CDC guidelines, nor the guidelines that were coming out of the state. So what we found within these particular communities, and ours included, is we were able to prioritize our elders right away, and not 70 and up. I think that was the initial rollout for the CDC. But, we know that in Native communities, our folks aren't living that long. And so we started our elders 60 and up, and we were able to prioritize folks who are particularly homeless, like, for example, that are already established within our elders programs that we have relationships with. We did the pre-education work that we needed to do. And we were able to preserve our languages and protect our cultural keepers and those types of folks. And that comes with having authority and autonomy over decision making. So I think in some ways, Indian country is being really touted as kind of model for community-based vaccination rollout, and a really successful model. And I think that this is why, is because we had enough supply to be able to support our communities. And, this is something that I look forward to in the future. The Biden administration recently actually distributed vaccines directly to the community health centers. And they did that because many of the community health centers didn't even have enough vaccines to vaccinate their staff. And so, and they also know that community health centers predominantly serve underserved populations, largely BIPOC communities, already have established relationships with folks, and so had a ready-made population to work with. And so things that can become challenging when you're doing things like pop-up clinics, or, driving a mobile unit into a zip code where, folks of color live, are easier in community health systems because we already have them in our systems, and getting them enrolled, making sure that they come back for second doses, really planning, for inventory. I think that those things are really effective. So I think that the fact that our governor is honoring the Centennial Accord and acknowledges and honors sovereign nations' ability to do this work is one way that we're prioritized. You're not seeing that the same way in other states. So that's really key about being in Washington. I would also say that, I think that King County has done a good job reaching out to communities to identify materials and public health information that are more culturally attuned, and, recognizing that communities of color have had experiences with, these types of, vaccines, and even just healthcare systems generally, that cause a lot of vaccine hesitancy, and been able to work with communities to try to overcome some of those things. Yeah, so that's how I would say that communities of color are being prioritized.
Thank you. And you touched a little bit on the different vaccination site differences, the mobile sites. And so you have an FQHC, a stationary vaccination site. We also have Ahmed, who is providing vaccinations through your pharmacy. So this question is for both Esther and Ahmed. What are the differences between the vaccination sites, and what can community members typically expect to experience at those different sites?
Go ahead, Esther.
I was going to defer to you, Ahmed. I'm just so honored to be in the room with you, or the virtual room anyway. Go ahead.
Absolutely. Thank you so much. I think, Abriel, the one way I can easily answer in terms of the efforts that we've done through Somali Health Board and the 11 pop-up clinics, clinic vaccine sites we've had, is somewhat, I think, similar to what Esther had mentioned. I think the one link that made it successful for us is that there is actually an independently Black-owned pharmacy that has access to the vaccine from Department of Health. I think that played a big role, and I don't think it would have been at all possible to vaccinate almost 3,000 of our community members if that wasn't the link, because oftentimes the accessibility to the vaccine is the key to whether you're able to reach the community or not. And we were using basically trusted ambassadors from the community at the different sites where we're going, whether it's the churches or the community centers or the senior centers we were going to, or this past Saturday where we did 548 Uber and taxi drivers in Tequila using the Teamsters Union, outreach efforts. So I think for us, it's more of, and I would love to see down the road, BIPOC communities all across the county. I think the one way that we can reduce disparities overall, in my opinion, I've said this multiple times, is for community ownership, whether it's clinics, pharmacies, hospitals, that oftentimes where the nurses and the doctors and the pharmacists were treating folks, because at these sites we had nurses that speak different language. We had nurses that are from the community, people that they feel very comfortable and understand and know that they can answer those questions for them, and made it a lot easier. One question that we didn't anticipate on last Saturday that we just had to find a solution right there. And then was a lot of the Uber drivers were Muslim, and the Ramadan is coming up, and a lot of them were like, okay, well, I don't think I want to be getting my second shot while I'm fasting. So, so immediately right away, we have to find a solution and find a way to make sure that they understand that Islamically, you can get vaccinated while you're still fasting. And also you have other options as well. After 7 o'clock, there are places that you can get vaccinated. And we can also set up another pop-up clinic around that time. So that's not something I don't think that the large system would have been able, in my opinion, find a solution to that. And be able to do it in a real time and make sure that someone who walked in to get vaccinated leaves that place satisfied and got the vaccine and will come back happy. And then the other thing I can point out to is when on multiple of the vaccine sites, with the help of King County Public Health, we've been able to set up like for instance the church, and we have about 180, 200 people who showed up for the appointments that we or registered to be vaccinated, but then we have other family members who accompany them. So we had an open door policy where as long as people are actually in line by a certain time and they showed up, we're not going to be sending anyone back to make an appointment at a different time. They will just make a run at the pharmacy, make sure that we go and get more vaccines. And, I can remember 3 weeks ago, we had 160 people who signed up. But by the time we left, we had 207 people who were vaccinated because people were calling. And this is Skyway, which doesn't have a pharmacy, it doesn't have a clinic, it doesn't have a hospital. To my knowledge, I've known that area for quite a while. And this was the only pop-up vaccine that was there for that weekend. So the need is there. I think there are just many ways to reach the community. I just think we just have to be be mindful of what is accessible to them, but at the same time, be able to be agile in terms of decisions that we're making at the moment.
Can I jump in here? Because I so appreciate the community events that are happening. And I know we have a lot of community partners on this call as well, but I also want to encourage, because remember that King County alone has 2.2 million residents. Now that includes children under 16, but of that million plus adults, that's a lot of people. And so our communities should also have equal access and access that is appropriate at our high volume sites. And we're working really hard to make that happen. And some of that is about really training and making sure that people can make appointments easily and also access those sites with transportation help or whatever help is needed. So I want to encourage that the goal is to get everyone vaccinated as quickly, who is interested in vaccine, as quickly as possible. We certainly want to support in making sure that the community pop-ups and the Black owned and the Indigenous owned and other agencies are able to help provide that vaccine. But we also know that we've got 2 million people that we've got to get vaccinated. So I think having multiple strategies, we should all take advantage as people of color of all of the different strategies.
Thank you. So all of the rest of our questions are for all of our panelists, so please feel free to jump in. And you touched on as we're moving into new phases. So for all of our panelists, how can community members best navigate appointments as we progress into these new phases? Are there any suggestions, any tips, anything they should keep in mind?
I think the as Margaret had mentioned, I think there are a lot of options out there that people can go and get the vaccine, access to the vaccine, particularly the county and the city of Seattle locations. And also the options where pop-up clinics like the ones at Swan Health Board and other places that are being set up. The important thing is finding out where those locations are and how accessible are they to the community. Some of them you do need to call, some you need to go online and make an appointment, and so forth. I would suggest that folks to go and figure out if there's, and I think there is somehow a condensed version, or at least one system that we can utilize where people can call or even log on and determine where the vaccines are at this point, and who can get them. April 16th is right around the corner, where everyone will be eligible to get vaccinated that wants to be vaccinated. And we're also trying to make sure that the most vulnerable people have access to the vaccine. I think it's important that certain populations have specific knowledge of where can they go, that they can access, whether it's a language or even transportation barriers. I can tell you that sometimes for one thing that we've noticed is, someone can make an appointment or show up to a vaccine site, but they need someone to help them complete the intake form, right, before you actually get the vaccine. And that is also another barrier. Sometimes some folks might experience that. So if there are some pop-up clinics out there within the community, go ahead and take advantage of that. But at the same time, if you come across a specific place where you have access to right away and you are eligible to get the vaccine, I would highly encourage everyone to take advantage of that.
April, if I could just go back a little bit, we were talking about differences between kind of clinics, what they can expect. Is that okay if I do that? Yeah, so I want to point out that our clinic, our vaccination clinic, is run by our clinical pharmacist, by our pharmacy director. And we actually had a whole team of clinical pharmacists who were our original staff folks who are staffing the clinic. So we have an incredibly efficient system, a really tightly monitored inventory. We did specific calls for outreach, but I would also say that we partnered with other organizations. So for example, we have good partnership with Chief Seattle Club. So we were able to take our vaccine clinic on the road and be able to vaccinate people at Eagles Village or vaccinate people at the King's Inn when they just opened that recently, and other hotels. Also, some of our key, most vulnerable folks in our community. But that happened through partnership where we already had a contained environment and made it much easier to kind of navigate appointments and make sure that people showed up, and more importantly, show up for their second vaccines. So I'm really proud of that work. We also vaccinated some of our partner organizations so that the way we think about it, or the way I think about it, is it's kind of like expanding the sphere of safety for our community, right? Like, so who are all of the folks that support our and serve our people, our American Indian, Alaska Native people? And those are the folks we vaccinated. And so we just keep trying to grow and grow and grow that sphere of safety. So when you at the Seattle Indian Health Board, you have to call. We have a special call line to be able to get signed up for a vaccine. We are prioritizing Native people, but it's not solely limited to Native people at this point. And yeah, and you can expect a call back within 48 hours, and you can get signed up for an appointment. And for other community orgs, we've partnered with other community orgs. We had a group reach out and wanting to get their Pacific Islander elders vaccinated. So we were able to put a special call into the state to get an additional amount of vaccinations for that group. And then we dedicated specific time for that group. We did something similar with Seattle Public Schools, partnership with Denise Juneau to vaccinate their special education department. But we had to put a special call into the state to see if we could get that amount. And so we only vaccinated the amount that we could actually receive. But again, a really tightly run ship. I'm proud of the team. And, we just really welcome all of you. We are related and we want to vaccinate as many people as we can as well.
Thank you. And Marguerite, did you want to weigh in on tips or suggestions as well? No.
I think I think it's been well covered. Yeah.
Okay. Our next question is for all of our panelists. Can you share successes and lessons learned on supporting or going through clinical and community partnerships? What might you do next time to improve partnerships or vaccination of hard to reach communities?
So I'm just going to say, lessons learned. Again, if you already have established relationships with community partners, begin there. Do it well, and then you kind of learn what you need to tweak. I also just want to point out that any organization doing vaccinations, do not underestimate the need for support services. I mean, we overloaded our phone systems. I mean, we had as many phone calls that we typically get in a month in one day, and we were not prepared for that. We had to hire a whole call center team, and that was a little bit crazy. I wasn't entirely prepared for that. And just kind of being patient. And one of the things I love about our team is they're just really treating people with kindness, respect, and love, even when it's really challenging, because people are scared. So I think that those are the main things: is give yourself some grace, know that you'll make mistakes, and just stay grounded and focused on community, and you'll make it through.
How did Seattle Indian Health Board come about with their partnerships? If some of them were established already, or did some of them reach out to you?
Yeah, it was both. So the established ones I've already spoken to, right? Kind of expanding that sphere of safety. So organizations that were providing direct service to our communities. And then the folks who reached out to us, quite honestly, it was other Indigenous communities, Pacific Islander community. We've been in conversation with African American Health Board recently, we find those ways that we're connected, right? Like our Black and Indian connections, and trying to build upon that so that we can best serve our people. But we recognize that it's a cultural experience as well as just as getting a vaccination. It has to be, because we have to be able to acknowledge some of the things that Ahmed suggested. If you're Muslim, there are some special considerations, so we have to be mindful of that. So yeah, that's how we selected partners. And then obviously our tribal partners are always really key. We follow their lead in a lot of ways, and we support one another.
I'll just jump in to say that the role for us of having community health workers and community navigators has been really critical, so that we have sort of a rapid feedback cycle and loop of when things are not working with a clinical partner in particular, and that they're not providing care in the way that is acceptable to our communities, and so that they can learn directly from the feedback from our community navigators and community health workers. That continues to be really, really important in developing these relationships. And so, at least at Public Health, our team that I think Matias Valenzuela, Marielle Torres Metapor, and others have been doing, and as well as through HealthierHere, we're trying to share sort of, here's best practices, here's what works for our community, and so that constant education and feedback loop to make these partnerships more of a success. And I think we've got a lot of matchmaking still to do because we've got a lot more people to vaccinate. And so hoping that additional dollars will come out quickly to support community-based organizations to help engage, particularly in the community vaccination events or the pop-up clinics.
Yeah, the one thing I can add is, the same that Esther had mentioned earlier. I think there's already built relationships which we continued to work on. Remember early on we had, I think about a month or so ago, we had Desta Brown Children's Hospital reach out to us that, they received extra doses of vaccine, and this is when the vaccines were not rolling out as much, but 250 doses that needed to be utilized within 3 days. So worked with Living Well Kent and the African American Health Board, and decided to reach out to a lot of communities in Central District and other places. And I think it made it a lot easier for us because we was already built up relationship with those partners well in advance before COVID. But more so, I think the other thing that's worth noting is that I think there are a lot of folks who really want to help during the pandemic, particularly health professionals that have really answered the call. Nurses and retired physicians, and who many of them we've had relationships in the past, and folks in the public health as well. And I think it's also worth noting that all those folks and those build relationship with individuals, not just organizations, are also answering a lot of the calls when it comes to finding ways to spend time on a weekend and volunteer on those big events that we're pulling off. Because I don't think it would have been easier for us to actually do that had we not have about 20 or 30 volunteers on our volunteer listserv who actually come on the weekends, and anywhere from being a vaccinator to helping complete the forms, or even just making sure people are social distanced well on the line and so forth. So I think that's one thing that we didn't quite think at the beginning that we actually needed all those, but as we're doing these events from 100 to almost 600 now, that we realize what we need is more involvement from folks who actually want to give back to the community.
If I had more supply, I have to tell you, I talked with Denise Juno. I mean, they had 20 to 30 nurses, or I don't know, I think she said 30 to 40 nurses, school nurses, who could have given shots, right? Could have gotten shots in the arm. We could have set up like really solid clinics as in a partnership because we needed staff, right? And then supply is a challenge. But those are the types of things I want to see systems do better, right? If you have 20 to 40 nurses in Seattle Public Schools who cannot work because we don't have any kids in school, put them to use. Let's get it together. That's what I think about. Like if I could have done something differently, would have been that.
And getting vaccine, right? I mean, we need the vaccine. Yeah.
Yeah, we definitely need the vaccine. And so all of you have kind of just touched on the need for removing those barriers and getting the vaccine and utilizing resources that are not being tapped into right now. How have each of you, or how do you see moving forward, removing those barriers to access, to vaccine access for community? Like I know some of you touched on language barrier, removing that barrier, locational access, and emotional stress, and how that can play a role into community members feeling safe coming into the clinic. The emotional stress of if it's high volume, if it's low volume, safety, social distancing. And Marguerite, you're on my screen, so we can start with you.
Oh.
You're spotlighted for me.
I'll just say that one of the things that I think has been most important is getting information out and really the personal stories of being vaccinated and having people champion why it's so valuable and important to get vaccinated and to continue to get tested and to stay safe and wear masks. This affects all of us. So I'll just I'll say it's been a really hard time, and we do need time to heal and take care of ourselves. And so I'm grateful for everything that our communities are doing, and as well as our providers. But we've got this. I mean, we know what needs to be done, and these partnerships are so important, as well as then really taking the lessons that we've learned from. And I'll go back again to the community health workers. This is why it's been so important to understand that language matters, being transparent and giving people the information that they need so that they can make the decisions, and then really breaking down the barriers. So for people who are working, the 2 or 3 or 4 jobs and really have very limited time and availability, making it as easy and going to them instead of having them have to come to us. I mean, those are some basic things that we just have to do and learn to do better.
April, one thing I can add to what Margaret mentions, I think it's also important that we continue the education around COVID as well. I think right now we're talking a lot about the vaccines, but people are still coming down with coronavirus. We also need to continue having that conversation, right? It shouldn't be one or the other, and also continue to point to folks like, should they have symptoms of COVID, the coronavirus, to get tested. There are multiple testing sites across the county. But I think the emphasis in terms of the education, right? I think as more people become more eligible to get the vaccine, we want them to be able to feel comfortable to get the vaccine. There's a lot of education that's gone out to specific populations across the country. Folks reach out to the seniors and healthcare providers and so forth. But now we have a large number of the population that is now coming up to get the vaccine. Are they informed enough? What should they expect? Where should they get the vaccines and so forth? And I think it's fun and exciting to see people post on social media when they get the vaccine, and it's great. But then there are also people who are still uncomfortable about the entire vaccine, and having enough resources to make sure that those folks understand the significance, why they should be vaccinated, so that we're all healthy all across. So I think there's a lot of that conversation that needs to go into the community a little more. And I'm always talking about the COVID testings, because I feel like the vaccine is the thing to talk about now, but we're still seeing a lot of people who have coronavirus as well.
I would agree. I think, removing the barriers, it takes a lot of the pre-work, meet your community where they are, show up for them. I think that's one of the reasons we did pretty well, because we did several community panels, again, partnering with Urban Native Education Alliance. They work with so many of our Native families, and, the youth actually led the discussion, and they asked really hard questions, and they called us to task. They said, hey, are you asking us to do something you're not willing to do yourself? We want you to go first. Like, you do it first and show us it's okay. And then I would say that, our public health authority, Urban Indian Health Institute, released the only report of its kind, which really asked community about the COVID vaccine and what inspires them to get it or not. And what we found was the reasons our community are willing to get vaccinated is because they want to take care and protect their communities, right? Whereas what we see in kind of these Western systems is to protect themselves, right? And so when we start talking to our folks about getting the vaccine and even getting tested, it's all about community. And so being able to adapt and tailor our resources and communication to that has been really useful. And yes, definitely community champions have been really key. I shared a link to the website where you can access all of our resources and take a look at the things that we produced. So.
Thank you for sharing that. Thank you. And one of the common themes that I heard in everyone's answer is the wealth of knowledge that sits with community members and with our community, and tapping into that. And we would like to engage our community members that are on the call on our webinar right now. So Mayani is going to post a chat box engagement into the chat for everyone to kind of respond to. So we're going to ask, for those of you who might have received the vaccine already, if you'd like to share an example of what you did or what you or would do to alleviate those emotional stressors. And feel free to share those in the chat box, kind of sharing this community knowledge, sharing your personal stories of how to alleviate those personal stressors that you feel your community members might have of going into a high volume vaccination space, or how to, if you went with a buddy, if it was a buddy system, what worked for you and your community, sharing that knowledge in the chat box. All right.
I'll just that I just got my first vaccine shot like a week ago or so, a little bit over a week ago. And I was really excited and felt really blessed to be able to access vaccine. But the second one was my daughter was so relieved. It was just, I mean, it brought her actually nearly to tears, because just being able then for my parents to be vaccinated, for me to get vaccinated. And so it was not what I didn't expect that emotional stress to like be able to be addressed like that for her. And that was really touching to see.
What kind of, and that kind of leads us into our next question, which is how can community members plan for that post-vaccination care after dose 1 and dose 2? What should they plan for? Should they plan to maybe try to take a sick day afterwards? What should they be monitoring, and what should flag them as maybe a high level concern to reach out to their primary care provider?
I think the one way to look at this is there isn't a simple answer to that. I think everyone's response to the vaccine is different. Our bodies are different. Our immune system is different. But most importantly, what I tell folks is that, most likely, because you got a needle going through your arm, it definitely will feel a little warm. There is some slight headache for some folks. Tiredness is possible. And I've had someone who say, I don't think I like those. I think I'm okay not getting vaccinated. But so I kind of reminded that individual that actually that's a lot easier than getting COVID on any given day. So for some people, a day or two is possible, right? I had when I got mine, I received mine in late January. So I had a little bit of a headache. I remember that, and a little bit of a temperature the first dose, and that was it. But the second dose, didn't feel anything at all. And some people, it's the other way around. But it's nothing I wouldn't consider. It's not manageable for a day or two. And if you have to take a sick day, that should be fine. I think, in my opinion, if you're able to do that, stay at home, watch some Netflix, get some snacks, and I think that's one way just to be able to quickly recover. But most importantly, I think getting the vaccine is the ultimate, most important thing you want to do for yourself and your loved ones and your entire community. Because as soon as all of us, probably 80% of us, vaccinated across the country, I think we will be in a very good trajectory to at least defeat this pandemic. And that's I think that's one thing that folks need to kind of remember.
Thank you. Thank you for sharing that. And I like that, sitting with Netflix and some snacks. I'll take that one. So as we're moving into new phases and getting more people vaccinated, and Esther, I know that you've done a lot of partnership in doing getting a lot of our Native community vaccinated. what have you been sharing, or what should we be sharing with community members to expect after they've been fully vaccinated? And we did touch on this a little bit, but what should or shouldn't they be doing? Should they still be wearing masks? Should they still be social distancing? How should they be approaching it?
Yeah, absolutely. I mean, I'd say that this is where we would follow the CDC guidelines. You should absolutely still be wearing a mask. I believe double masking is the recommendation at this stage. Obviously, because there are variants, but even if you've been vaccinated, you can still expose somebody else who hasn't been vaccinated. And that's really key. So yeah, and still engaging in social distancing, unless you have your household vaccinated, you don't want to gather with groups beyond what the CDC is recommending. So I fully support following the CDC guidelines. You got to still stay safe. And, back to Ahmed's point, there are still people getting coronavirus. You need to get tested. It's pretty crazy to see how there's been a significant drop in the number of tests we're doing now. So.
And the rates are actually going up very quickly. And that is at a point where we may slip back into phase 2. So it's not only that the rates are going up, but hospitalizations are going up as well.
That is good advice. Thank you. Thank you. And we are going to move into our open Q&A session. So I want to remind our community members to please feel free to add your questions into the chat. And while you're adding your questions into the chat, I'm going to read just a couple of the questions that some of our community members are registered, sent in a question ahead of time. And if you'd prefer to ask your question directly, we are going to ask just a couple of these. I'm going to pass it over to Mayani to ask 1 or 2 questions after these few, and then we're going to open it up to raising your hand and being able to answer your question verbally if you're more comfortable with that. So one of the questions that came in advance is, what is your advice for someone who shares a household with someone who refuses to get vaccinated?
I think my advice is, you share household, you're in the same, you've lived with this person, it's not a stranger. Of course, when we are on a house and our own family members, we're not masking, we're within the same perimeter. From a clinical perspective, I don't think there's anything that we could tell you that's different. We're not going to ask you to mask up in your own house, right? That's not a recommendation, because you are living in the same within the same perimeters. But I think the only advice I would is to encourage that person, your loved one, and talk to them and make them understand why it's important to be vaccinated. It's of course we're not going to convince almost everyone to get vaccinated, but I think if our love, for instance, for my mother, if that was the case, I would have shown her multiple reasons as to why she should be vaccinated, or for a family member, and continue having that conversation. But I don't think there's anything else that I can add to that, other than if that's the case, you just have to continue. When you're out there in general population, then you still have to continue to mask up and follow social distancing and so forth. I will let Esther and Marguerite jump in as well.
I'll just say that that we still have lots of places that are offering free testing. And so especially if the person is not going to get vaccinated and is in situations where they could be exposed, that having that information allows them to protect their family members as well as themselves. And so you can take advantage of the free testing that is out there right now. And as the weather gets better, I mean, being outside, opening your windows, creating the ventilation in your house, working on all of those things will just help to lower the risk of transmission.
All right. Did you want to jump in, Esther? No? Okay. Uh, another question that came in, a pre-question was, which sites have walk-in appointments available?
We had this discussion a little bit earlier. I don't think any of us know of a walk-in option.
I think Tavish early on mentioned that CMAR has a walk-in, and I think you have to go to their website, walk-in availability, go to the website, and that's the only way to determine if actually there is a walk-up available at one of their locations. But I think it's a little bit difficult, in my opinion, from operations perspective, with its clinics, hospitals, and other places or pharmacies to actually have a walk-up clinic, because there are just many operational requirements that, whether if you have appointments for people who have a vaccine, because each week you have allocated a specific amount of vaccine that the DOH supplies. Unless you factor those, I think it'll be a little bit difficult to have people walk in into those sites. But there might as well be. I think the only resource right now that we know is CMAR, and the web. I think the link was just posted on the chat as well.
Yes, Tavish posted the CMAR link in the chat if you want to utilize that resource. Thank you, Tavish. Thank you, Ahmed, Marguerite, Esther. Our final pre-question that was sent in is, why are some people dying after the vaccination if it's safe?
I think importantly, there has that every death that is happening during the period when somebody has been vaccinated is being investigated. But right now, there's no evidence that shows that a COVID vaccine has actually caused the death. Folks who are having severe reactions or these incidents of death that have been reported are ones where people have generally had pre-existing conditions. And again, I'll just say there are no known instances of death due to COVID vaccine.
The only thing I can add to that is I think there's no significant, or there's no studies showing honestly someone who's been vaccinated and dying from COVID, right? As Margaret has mentioned. But then there are also the risk of a small percentage of people who are vaccinated still able to get COVID coronavirus. That's about not 5%, as I mentioned early on. And that's why there is a lot of cautions about, the mask and social distancing, despite whether you are vaccinated or not. But the message here, and I think that Margaret eloquently put it, is that vaccines are not going to kill anybody. There isn't any studies or anything has shown at this point to date here in the United States, in any of the 3 vaccines that are currently being used, that vaccines are actually causing death. I think if someone has, died because of COVID, I think there are other causations, but not the vaccine.
Thank you. Thank you for answering that question. And I think that, so if questions have been coming in the chat, Mayani has been collecting those. Mayani, do you have any questions from our chat box that you would like to ask of our panelists?
I do, yes, thank you. I have a couple, or a few. The first one is relating to the J&J vaccine. Does it use DNA? And if so, where did the DNA come from?
That's a really good question. Go ahead, Margaret. I don't think I've looked into where the DNA comes from. It doesn't use, it uses the SARS-2 protein technology, but I don't think it's not like a messenger RNA. So I don't know where that.
Yeah, it's not it uses another virus to transport the. There's some actually really good videos that explain adenovirus, what an adenovirus vaccine is, and the adenovirus vaccine is very much like your routine flu vaccine that we get every year, and so it's not inserting any DNA into your body that would mutate your DNA, transform your DNA in any way. So I think I would answer it that way. I'll put a link into a good reference.
Great. So the next question is, April asked the next question, but you can cue me for how you want it to flow after this. But we had a couple of questions actually come in about how to determine if a vaccine is actually effective in preventing someone from acquiring COVID. People have talked about checking to see if they have antibodies after getting vaccinated by taking an antibody test. What is your opinion? And or is there some product or service or way to know that once I got the vaccine, it was actually effective?
Yeah, I don't think it's really necessary for anyone to take. In my opinion, I don't think it's necessary for folks to take antibody tests to determine, if the vaccine is effective. I think the vaccines have been proven to be effective. They are doing what they're expected to do, which is, protect your body and build immune system. I think there are a lot of questions that come along where some people say, I've got the COVID, I had coronavirus, and did that make it, did my body build antibodies so that I don't need to get the vaccine? There isn't any studies showing that's actually, those antibodies actually last that long in comparison to the vaccine itself. And I would not necessarily spend a lot of time or look for resources to search and see, do I need to take an antibody test to see how effective the vaccine is? Enough studies have been done, and we've seen millions of people who have been vaccinated, and the vaccines are showing and proving that they're effective once you get the doses that you expected to be getting. The same way that vaccines have been effective from influenza or meningitis or polio that were vaccinated when we were younger. They work the way they're expected to work. So I honestly would not think it's necessary to determine whether you have, using certain tools or going and getting blood drawn to determine what your antibody levels are. At this point, what we know is that once you get vaccinated, until further studies are done in large samples across the country, how long those vaccines are going to last will be determined. And this is always a working, data is being collected and studies are being conducted to determine how long the vaccines we've received are going to last in our bodies, right? Are they going to be an annual thing where we have to get back, just like the influenza vaccine, or are they going to last longer than that? So, I think that with regards to that question, I would not necessarily spend resources and time, drawing in blood and checking what my antibodies are, other than actually getting vaccinated and trusting that these vaccines are effective for what they're intended for.
Thank you, Ahmed. And I see that Marguerite has added that resource into the chat, the link. Mayani, did we have any other written in questions in the chat box?
I did. We have a question about how are Black homeless folks being reached to vaccinate them?
So our healthcare for the homeless team has been working on different strategies, working with both the homeless service providers and particularly working on mobile vaccine delivery and working to reach folks.
I think that's where the Johnson & Johnson vaccine comes handy in this
Yeah.
case, right? Yes.
And Mayani, do we still have a few more written questions?
Yes, there is two questions that I have.
Okay.
The first one is around, so, someone kind of mentioned that the panelists are referring to it as the vaccine, though there are multiple vaccines that exist. And we're wondering if you could kind of drill down into information regarding the pros and cons of the available vaccine options. I think kind of beyond the one shot versus two shot, but if there are kind of pros and cons to its effectiveness or how it impacts your body or how it was produced or created, folks are wondering if you could speak to that.
Ahmed, did you want to jump in or?
No, go ahead. I can follow up.
Well, I think Ahmed, in the response to the first question, I'll just say it's a little bit hard. Number one, it's very hard to compare Pfizer and Moderna to the Johnson & Johnson, in part because they were developed and sort of tested at different times in slightly different populations where different COVID strains were happening. But what all three of them have shown is that they've been really effective at preventing serious illness and death. And that's part of what we want to do. And importantly, helping us to stop the transmission of COVID. So from that perspective, all three of them are very, very similar. I think that two of them, again, are mRNA vaccines, the Pfizer and the Moderna. And the Johnson & Johnson or Janssen vaccine is an adenovirus vaccine, again, similar to the flu vaccine. So the general advice that we're giving out in public health, and I'll say true for myself, which is not seeking out a specific vaccine, but I was ready to take the first vaccine that I could get available. So while there's some differences in how they were created and testing, not from a effectiveness standpoint, all three very strong, very good. And so I know I'm sort of skirting the answer, but is there something if it would be helpful to, for whoever asked that question? I don't know if you want to go off mute or if you want to ask specifically, is there something that you are particularly interested in terms of the difference in the vaccines?
So I believe that this person would prefer to be anonymous.
Okay.
And maybe a follow-up clarifying question is around if there are, what are the risks associated with each vaccine option?
Yeah, I think the risk options, the risk associated with the vaccines, and we keep saying the vaccines because I think it's one way to talk about without having to talk about specific vaccine. As Marguerite has mentioned earlier, that it's like comparing apples to oranges. The vaccines, the messenger RNA was actually developed way earlier when the pandemic was going on, and the study population is different than the population that was used for Johnson & Johnson. But as far as, the side effects, I had mentioned earlier, the injection site reaction, some people feeling tiredness and headache, temperature is possible as well. And those are things that are common, I think, to all the vaccines for any given person, should they, depending on their immune response to the vaccine itself. But I don't think there is one that is different than the other. And I think at the end of the day, as Margaret has mentioned, the important thing is that they're all going to be doing one thing, which is to protect us from contracting COVID and death or severe coronavirus to a certain extent. So, short answer is that I don't think we have specifically and a lot of things. One we also need to know is like these are vaccines that are approved for emergency use, right? So there's a lot of information also being collected. And like if you were asking me about meningitis vaccine, or if you ask me about polio vaccine, what side effects should we expect? Those are readily available and to a certain extent have been documented for quite a while. What we know is that these vaccines are safe and they're efficacious. And with over 120 million Americans already vaccinated with either one of those, it's showing that they are actually working.
Thank you, Ahmed. Thank you for sharing that answer and really explaining it. And I think we're going to go ahead and ask if any of our participants would like to raise their hand. Please go ahead and raise your hand now, and Tavish will call on you to ask your question directly. If you need help locating the raised hand option, you can go to the bar at the bottom, go to participants. At the bottom of that, you will see invite, mute, and on the far bottom right-hand side, you'll see a raised hand button. Please click that if you would like to ask a question directly to our panelists.
There's no raised hands yet, but we do have another question in chat from Lorraine. Yeah, how often will people need to take the COVID-19 vaccine?
So I don't think folks know this answer yet. And part of the reason why folks don't know the answer yet is because as people are hearing about the COVID vaccine and the virus and it's mutating, right? And so there are different strains of the COVID vaccine or the coronavirus. One of the things that we're waiting to understand in the United States is as the virus itself is mutating, what will be the predominant strains as we look in the future. So we've heard of the these different variants, and some of them are tend to be a little bit more contagious or more transmissible. And we're currently doing some of that sequencing to understand the impact of those variants and how predominant they are here locally.
Thank you. Mayani or Tavish, are we seeing any raised hands or any other questions coming in?
I had one other question that came in around if folks could address the language around the vaccine versus the available vaccine options. I think maybe that came up a few times, and people were curious if there's a difference or what the reason is for that language.
I think I can answer because I'm using that word vaccine to lump up the 3 vaccines that are currently available to use in the United States. I mean, we could say the Pfizer vaccine or the Moderna vaccine or the Johnson & Johnson vaccine. But in order to have this conversation, I think the language that I'm particularly using here is the vaccine, just to shorten that conversation around what we're discussing here. But I don't think there is a specific reference to a particular vaccine as we're discussing the three options that are currently available here in the United States.
Okay, and that's all of the questions that I have. April and Isabel is putting in the chat just to thank all the panelists so much for the information.
Thank you.
And there's no raised hands.
All right, wonderful. Sounds like we got all the information that the community members were seeking or wanted, and all the questions answered with 3 minutes to spare. So I just wanted to thank all of our panelists for taking the time to come and share your knowledge, your experience, share information about COVID-19 and the vaccines with our community members so that they feel informed and confident to share this information back to their community members as trusted messengers. And I just want to remind all of our community members and our participants to please go and copy the chat and copy those resources links that were added in there to be able to share back to your community members as trusted information carriers. And thank you everyone for joining us. Thank you, Ahmed. Thank you, Marguerite. Thank you, Esther. Thank you to all of our community members, our CBO staff members to be sharing this information out, and our clinical staff members to be sharing this information and to be supporting easing that emotional stressors that were shared in the chat, and sharing that information out as trusted messengers. So thank you everyone for joining us. I hope you all have a wonderful Tuesday evening, and you have 2 minutes back of your time.
Thanks everyone.
Thank you.
Bye.